Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
Fever. Introduction. A fever is when your body temperature is higher than normal. This is usually caused by an infection or disease. Nearly everyone will have a fever at some point in their life. It is important to know when you can treat a fever yourself and when you should seek medical advice. This program explains fever. It discusses what causes a fever and what you can do to treat a fever. Body temperature. When measured orally, the human body maintains a normal body temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius. The body temperature varies a little during the day. In the evening, the body temperature is usually the highest. Your body temperature may also increase when you have been exercising, eating, taking certain medications, or if you have been in a hot environment. Women may experience a higher body temperature when they are ovulating. When your temperature is taken through your ear, your temperature reading will be slightly higher than when it is taken orally. When your temperature is taken axillary, or through your armpit, it will register slightly lower than when it is taken orally. Rectal temperature usually runs 1 degree higher than an oral reading, and axillary temperature usually runs 1 degree lower than an oral reading. A person with an oral temperature of 100 degrees Fahrenheit or 37.8 degrees Celsius would register a rectal temperature of 101 degrees Fahrenheit or 38.3 degrees Celsius and an axillary temperature of 99 degrees Fahrenheit or 37.2 degrees Celsius. A fever is usually defined as at least 1 degree Fahrenheit or 0.6 degrees Celsius higher than the normal body temperature or 99.6 degrees Fahrenheit, 37.6 degrees Celsius. Measuring body temperature. Placing a hand on the forehead of a child or a person may give you an indication that he or she has a fever, but using a thermometer is more reliable. For children, body temperature may be measured in 4 different ways: rectally, or through the rectum, tympanically, or through the ear, orally, or through the mouth, axillary, or under the armpit. A rectal thermometer measures the body temperature of babies through their rectums. A child has a fever if their rectal temperature is 100.4 degrees Fahrenheit, 38 degrees Celsius, or higher. Rectal thermometers are most reliable. They are recommended for children younger than 3 months. An electronic ear thermometer measures body temperature through the ear. It is recommended for children 3 months old to 4 years old. A child has a fever if their ear temperature is 99.5 degrees Fahrenheit, 37.5 degrees Celsius, or higher. An oral body temperature is measured by the mouth. A child has a fever if their oral temperature is 99.5 degrees Fahrenheit, 37.5 degrees Celsius, or higher. It is recommended for children 4 years or older. An axillary body temperature is measured under the arm. A child has a fever if their axillary temperature is 99 degrees Fahrenheit, 37.2 degrees Celsius, or higher. This is less reliable but can be used if needed. Avoid using glass mercury thermometers. Mercury is toxic to the environment. Use the digital thermometer of your choice and follow the instructions that come from the manufacturer. Fever. A fever is often the body's response to an infection. A fever is not a disease. It is a sign of a disease. Bacteria and viruses that cause infections thrive at the normal body temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius. A fever is your body fighting for you against the bacteria or viruses that cause infections. It does this by creating an environment too hot for the bacteria and viruses to survive. A higher fever does not always indicate a more serious health condition. A serious disease may cause a low fever, and a simple infection may cause a high fever. Let your healthcare provider know that you have been experiencing a fever, no matter how high or low it is. If the body temperature goes above 107.6 degrees Fahrenheit or 42 degrees Celsius, it can cause brain damage, but this rarely happens. It is important not to overdress a child with a fever in order to not raise their body temperature too high. In children, fevers can sometimes cause seizures. Seizures caused by a fever don't cause any permanent damage and often don't last long. You should check with your healthcare provider to make sure the seizure was caused by fever and not another disorder.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes. The most common cause of fevers is an infection. Common infections that often cause a fever include pneumonia, appendicitis, or skin infections, respiratory infections such as the flu and ear or sinus infections, urinary tract infections, gastroenteritis. Other than infections, fevers can also be caused by autoimmune or inflammatory diseases. Arthritis, vasculitis, and ulcerative colitis or Crohn's disease are examples of these diseases. A fever may be the first symptom of some cancers. Hodgkin's and non-Hodgkin's lymphoma and leukemia may present first as a fever. Heat illness, such as heat stroke and certain medications, can also cause fevers. Teething and immunization shots may raise a child's temperature, but fevers caused by teething or immunizations are usually lower than 100 degrees Fahrenheit or 37.8 degrees Celsius when measured rectally. Accompanying signs. Your child or the person with a fever may have other symptoms. This depends on what is causing the fever. For example, additional signs may include shivering, sweating, muscle aches, loss of appetite. As fevers go higher than 103 degrees Fahrenheit or 39.4 degrees Celsius, it may cause hallucinations, confusion, and dehydration. Convulsions are also possible. When you call your healthcare provider, it is important to describe the accompanying signs in addition to the fever. When to seek medical advice. Knowing when to contact your healthcare provider is important. For adults, you should contact your healthcare provider if your fever has lasted longer than 48 to 72 hours, stays at 103 degrees Fahrenheit, 39.4 degrees Celsius or higher, is over 105 degrees Fahrenheit or 40.6 degrees Celsius and will not come down with treatment. You should also contact your healthcare provider if you have fevers that come and go for a week or longer, have pain or burning sensation while urinating, have new rashes or bruises, have traveled to a developing country recently. People with certain medical conditions should also contact their healthcare provider when they have a fever, even if it is mild. These conditions include heart problems, diabetes, chronic lung problems, problems with your immune system. If a child younger than 3 months old has a rectal temperature of 100.4 degrees Fahrenheit, 38 degrees Celsius or higher, or if a child 3 to 12 months old has a rectal temperature of 102.2 degrees Fahrenheit, 39 degrees Celsius or higher, you should contact your healthcare provider right away. A child under 2 years old with a fever that lasts longer than 24 to 48 hours should be seen by a healthcare provider. Children older than 2 years old with a fever that lasts longer than 48 to 72 hours should be seen by a healthcare provider. Any child with a fever higher than 105 degrees Fahrenheit or 40.6 degrees Celsius should be seen right away. You should contact your healthcare provider if your child has fevers that come and go for a week or longer, has pain while urinating or other symptoms that need treating, has new rashes or bruises, has traveled to a developing country recently. You should also contact your healthcare provider if your child has a fever and a serious medical condition, immune system problems, He or she recently had an immunization. Get emergency medical care if you, your child, or a loved one has a fever and can't walk or be awakened, acts confused, isn't breathing well or has blue lips, tongue, or nails, has a bad headache or stiff neck, has a seizure. Children suffering from fever may also refuse to move a limb. They may cry constantly without calming down. These are also reasons to seek emergency medical attention. Diagnosis and treatment. Your healthcare provider will ask you questions to determine the cause of the fever. This includes questions about your other symptoms, when did the fever start, and what medications you or your child are taking. Tell your healthcare provider if you have been around anyone who is ill. If you have traveled outside the country, share this information with your healthcare provider. After examining you, the healthcare provider may order some blood tests to confirm a diagnosis. Additional tests may be needed depending on what infection or disease is diagnosed. Your healthcare provider may recommend resting at home without any medications, particularly if the fever and its underlying infection are mild. If the fever is high, he or she may recommend an over-the-counter medication to lower the fever. If the cause of the fever is a bacterial infection, the healthcare provider may prescribe an antibiotic. Home care. The best treatment for a mild fever is rest and drinking plenty of fluids. If you have no other symptoms or feel generally well besides the fever, you don't need any further treatment. While you can try to lower a high fever, you should not try to eliminate it. Remember, a fever is your body fighting for you against the bacteria or viruses that cause infections. If you have a high fever, you should take acetaminophen and ibuprofen to help lower your body temperature. Adults can also take aspirin, but children with fevers should never take aspirin because it can cause Reye's syndrome. Reye's syndrome is a disease where children with fevers who have taken aspirin suffer from brain and liver problems that may lead to death. Follow the directions on the packaging and check with your healthcare provider or pharmacist before taking any new medications. A lukewarm bath or cloth on the forehead can also help lower a fever. You should never try to sweat out a fever. Remove extra blankets and layers of clothing so that your body doesn't overheat. Never cool the skin with a cold bath or ice. Cooling the body too quickly can cause shivering. Shivering raises the body temperature. Children should also drink plenty of fluids and rest, but you should not give too many juice or sports drinks to children. If your child is still playing, eating, and drinking, and they look normal, then the fever is probably not serious. You don't have to treat them any further, but you should take steps to lower a fever if your child is vomiting, dehydrated, or not resting well. Remove extra blankets and layers of clothing from your child to avoid overheating. You should also avoid cooling the body too quickly. Check the instructions on packages of over-the-counter medication before giving it to your child. Check with your healthcare provider or pharmacist if you have any questions.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. A fever is when your body temperature is higher than normal. This is usually caused by an infection or disease. Nearly everyone will have a fever at some point in their life. It is important to know when you can treat a fever yourself and when you should seek medical advice. When measured orally, the human body maintains a normal body temperature of 98.6 degrees Fahrenheit or 37 degrees Celsius. The body temperature varies a little during the day. Your body temperature may also increase when you have been exercising, eating, taking certain medications, or if you have been in a hot environment. A fever is often the body's response to an infection. A fever is not a disease. It is a sign of a disease. A fever is your body fighting for you against the bacteria or viruses that cause infections. It does this by creating an environment too hot for the bacteria and viruses to survive. A higher fever does not always indicate a more serious health condition. A serious disease may cause a low fever and a simple infection may cause a high fever. Let your healthcare provider know that you have been experiencing a fever, no matter how high or low it is. The best treatment for a mild fever is rest and drinking plenty of fluids. If you have no other symptoms or feel generally well besides the fever, you don't need any further treatment. While you can try to lower a high fever, you should not try to eliminate it. Remember, a fever is your body fighting for you against the bacteria or viruses that cause infections. If you have a high fever, you should take acetaminophen and ibuprofen to help lower your body temperature. Adults can also take aspirin, but children with fevers should never take aspirin because it can cause Reye's syndrome.
Thank you for using Explain.